Hi, Dr. Seth Cohen. Today what I'd like to do is explain the importance and how I perform a penile duplex ultrasound. Okay, so as I've said before in some of my other videos, just labeling a patient with erectile dysfunction is just not enough because every man has his own severity of erectile dysfunction. And to truly understand the nature and the severity of erectile dysfunction, whether it's arterial insufficiency or venous leak, you need to perform a penile duplex ultrasound. So we have a B&K Flex Focus 400 here. This can be done with essentially any ultrasound machine. It just needs a specific probe that has a fairly low frequency to penetrate the penis in just a small amount, a couple of millimeters, so that we can look at the arteries and the veins within the penis. So in all my patients, I essentially inject a small amount of alprostadil to essentially dilate the cavernosal arteries so we have improved blood flow. This is sort of not universal. Every office does it differently, but that's how I do it in my office. So after I've injected the penis, I wait for a little bit of the erection to take effect, and then we start our duplex ultrasound. And so the first thing that we do is you take the probe and put it on a 90-degree angle to both the left and the right side, because that's where the corpora cavernosum are. Okay? You can see it in the video there. Now once you're at a 90-degree angle, you'll find the artery, which essentially looks like railroad tracks on both sides. And interestingly enough, you'll be able to see plaques. So in diabetics or high blood pressure patients with metabolic syndrome, you can see plaque deposit within the artery. Okay, so that will be sort of your first indication that there's an arterial issue. But really all the money lies in the duplex ultrasonography. We use a color duplex to scan each artery. You're not seeing it here, but color will show up, and once we place the probe over the area that's lighting up with color, you can measure the blood flow. Okay, so it's actually the velocity of blood in and out of the penis is what we're looking for. So that translates into peaks and troughs. Each peak here represents the blood going into the penis, okay? And in terms of a number, you want greater than 30 centimeters per second, okay, for a sort of a normal healthy penis, we would call it. And the troughs represent the blood coming out of the penis, which obviously in an erectile state you don't want any blood coming out of the penis. So in this example, the line down here is pretty much black. It's less than 3 centimeters per second, and that's what you want for a normal state. If you had venous leak, the trough would come down to somewhere like here, and then go back up, and then to here, and back up, and to here. And that would probably be greater than 3, say 6 or 7 or 8 centimeters per second. That would be an indication of a venous leak. Once again, in some people, they may have an arterial peak that's less than 30, all right, and a venous trough that's greater than 3, so now they have an arterial insufficiency and a venous leak. All right, so that's giving you an idea of the importance of a duplex ultrasonography for diagnosing erectile dysfunction. And once we have that, that allows me and the patient to sort of talk together in terms of our treatment algorithm. If there's not a great problem with arterial inflow or venous leak, then maybe pills are going to work just great. If there's a larger severity of arterial insufficiency, we may have to talk about other options like injection therapy and a penile implant.